Okay, I'm here at Nova Dental with Dr. Obando. Dr. Obando, very gracious of you to
My pleasure.
Sit with me. Now, we'll get right into the questions. First of all, can you tell me what your professional background is, your history, your training, your specialty?
Okay, Rod, as you mentioned, yes, my name is Dr. Obando. I'm a specialist in implant dentistry and cosmetic dentistry. My training was first dentistry in Costa Rica, then I did a 3-year residence at University of Chile, and then I did 1.5 years at NYU with the American Academy of Implant Dentistry and the Rosenthal Institute of Aesthetics.
Okay, and how often do you go to, or do you go to U.S. for training, and what type of training do you seek there, and why do many San Jose dentists go to U.S. for training?
Okay, yeah, pretty much for training or dental meetings, I go like at least twice a year, sometimes even 3. Like two months ago, I was in Seattle. Next week, I'm going to California to the Seymour Institute, and then on November, I'm going to another dental meeting. Okay, pretty much we like to have continued occasions. We like to go to the States pretty much because it's like the world conference, so pretty much we have the best people from Europe, from America, from Asia, new techniques, new technology. That's pretty much what we're looking for, okay? New procedures, and everything is for the patient, okay? Of course it's for us, but the one that have all the benefits is the patient. That's why we like to have continued occasions, and also all the staff that work with us have to be with this continued occasion.
Excellent, excellent. Now, when a person contacts you about treatment plans, prices, and they're asking you a lot of questions, can it become overwhelming to answer a lot of questions from a patient? Do you handle those questions? Do you have a patient coordinator that handles those questions?
Yes, we have a manager in the office, but we also have another doctor that is in charge of all the emails. I normally check everything, but we have a doctor. We like that it's a doctor, not that a patient coordinator, because pretty much the patient is going to ask about x-rays, time frames, things like that. So we like that this doctor is in charge of the emails. That's why we also have the manager if we have to have something else. But our time frame to pretty much respond to all the emails is less than 8 hours. Of course, Sundays is like if you write a Sunday, it's not that Monday first time. Maybe Monday at late at night you're gonna receive all the answers. But we try to have all the response and everything ready for the patient as much as we can.
Right. And when a patient hasn't heard from let's say they do send an email on a business day and it's been 24 hours. I mean, there's a reason for that.
Exactly.
And the reason could be...
Pretty much we're not sitting on the computer all day long, okay? We're sitting in our dental chairs, okay, working with our patients, and the priority in that moment is our patient. Of course, we try to respond to all the emails all the days and to have everything, all our inbox in zero, okay? But as you told you, Ron, we like to have it ready for all the emails response in less than 8 hours. Okay, so people can have an idea. Pretty much is when you do an hotel reservation, you would like to know exactly how it's going to be your fees and if you're available and things like that. So we try to do it as quick as we can. Okay.
Excellent. Is there something a potential patient can do when they contact you? Something they can have ready and send to you so that the estimate process goes as quickly and as smoothly as possible? What can they already have ready for you to send to you?
Exactly. We have like 3 types of patients that send emails. Okay, one that already have an estimate from another dentist in the States. So if they can send that right away, so pretty much we will have a really good idea. Okay, and we can send that estimate. We have another patient that already have the X-rays, and if they can send it, it's going to be better. Or we have patients that they just need to know how it's going to be a price of a veneer or a crown or an implant. Okay, so pretty much we tell always the patient, look, if you have any information that you can help us, send everything. Okay, don't try to say no, I'm not gonna send this estimate or this X-rays, because if they see it, maybe they're gonna do, or they're gonna charge me more because we're seeing the prices of the estimates in the States. We know we study in the States, so we know exactly how much is the prices and everything. So as much information we can have is the best.
Great. Now, I'm sure you get a lot of people who call, who are basically window shopping. They're calling all kinds of dentists. Do you feel that the number of people who actually end up coming to your clinic after contacting you, is that compared to the number of people who contact you in the first place, is that a high percentage? Do you feel that after they contact you, they're deciding to come to your clinic, or do you think maybe 50% that contact you they end up coming to your clinic, or do you think it's a higher number?
Yeah, in our dental office it's a higher number. Okay, we have on the market and doing patients from the United States, Canada, and Europe very long. Okay, so it's different. Pretty much most of the patients that contact us is because it's a reference, or they already know, or things like that. So it's easier for us. Okay, so pretty much most of the patients that contact us is because they're already coming to do a treatment plan. Of course, sometimes they ask about prices, questions, and before they fly, they have an emergency, they have to cancel. So sometimes we have patients that, since the first contact, 3 years later they come. Okay, so it's everybody have emergency, everybody has issues, things that happen. So, but we follow all those patients so we can have everybody come to Costa Rica and have the best work done.
Right. Now, I get a lot of emails from people who stumble across my website. They're asking me questions, and every once in a while I get somebody who asks my opinion of where the cheapest, or who the cheapest dentist is in Costa Rica. Now, in my opinion, that's not the correct way to shop for a dentist.
Exactly.
What is your opinion on that?
Yeah, pretty much. When you look for something cheap, sometimes you're gonna have, as we were talking, cheap materials, cheap treatments, the doctor, the staff. Pretty much what you will, if you're looking for a dentist or you're looking for something else, it's gonna be or the same what you have or something better for a better price. Okay, so pretty much what we like to have is that don't look for something cheap, look for the qualifications of the doctor, accreditations from the dental office, dental meetings from those dentists. I have a patient that once they told me, like, you know, doctor, I know more about you than my dentist that I have been for the last 20 years. Okay, I Google, I check, and I have all the information from you, and I already double check it, and we don't do that for my dentist that I go around the corner since the last 20 years. So the cheapest I think is not the best. Pretty much in Costa Rica we have lower prices, I will say, that worked, and the reason is because our staff is cheaper. Okay, our materials are cheaper, but it's the same brand, and they're doing it in the States. Okay, Latin America have a better price, like for dental implants. Okay, it's the same brand. Porcelain, we use German porcelain, it's the best one in the world, but we have a cheaper price. So that's why we have cheaper prices. It's not because we're doing cheaper things. Okay, it's because we're doing lower prices with the same, or in most of the cases, better things.
You brought up a good point about the German porcelain, because I know when I first started researching, I didn't realize there was different levels of porcelain. I thought porcelain was porcelain. Mm-hmm. And same with implants. There's different materials for implants, there's different levels of implants. And I think when people are shopping for the lowest price, they're usually going to end up getting what they pay for. They're going to get cheap porcelain, maybe a lesser brand of implant.
Exactly.
So that was a very good point. When I lost my train of thought there. When people do contact you, and what do you find are some of the most common questions? Are they worried? Do you find that most Americans and Canadians are worried about getting adequate dental work in Costa Rica? Do you feel they have an image of it's not modern down here until they learn?
Exactly. Pretty much they think about Costa Rica as a third world country. Okay, like maybe the facilities or the trainings or the doctor, it won't be the same as they have in the States. So pretty much they don't see it, they don't write on the email like how are you or how is your facility. Okay, of course they can look on the internet, but of course there's always a risk. of coming to another country. One of the most important things that we always do is that we try to do that our patients feel at home. Okay, we know how tired it is to travel. We know how difficult it is to go through customs. We know how it is to get to a country, open their mouth, begin to work. You don't know anything about the whole country, and you're already on a dental chair. So yes, we try to bring that to the patient to make feel at home. Okay, so pretty much getting back to your question is like what they do ask more or what are their risk. Okay, pretty much is what you're telling me right now. They don't know what to expect, but once they're here in Costa Rica, they say, I'm gonna do everything. Okay, sometimes they say, I'm gonna do just 1 crown, 2 crowns, or 1 implant, and once they're here, like, doctor, I tell 1 or 2, but now that I'm seeing all this, let's do my full mouth reconstruction. Okay, so
exactly, yeah. Now, if you can, what type of services do you offer here? Obviously, implants, since you're specialist in implants, but what types of teeth also do you?
Yeah, we are a complete dental service. Okay, we do fillings, we do root canals, we do porcelain veneers, zirconium crowns, IMAX crowns, dental implants, sinus lift, bone graft, everything we do. And one of the benefits about this office is that we have all our staff is right here. In some dental offices, you have to send somebody or somebody's coming to the office. Right here, we have a specialist in prosthodontics, we have a specialist in root canal treatment. Myself, I'm in charge pretty much of all the big cases about implants and full mouth reconstructions. Okay, so pretty much, and now all our staff is bilingual. Okay, so excellent. People is important for our patients.
Excellent. And what is your main advice that you would give to patients who are looking to come to Costa Rica for dental work?
Yeah, the most important thing is to be sincere with us. Okay, pretty much what they need, what their expectations. Okay, I tell the patients, look, we're gonna do our best, but of course you have to keep following a maintenance. Okay, that's one of my important advice. Okay, we're gonna do 100% our work. Everything is gonna be perfect, but of course there's gonna be a point that they have to go to any dentist to keep doing cleanings and things like that. Okay, what we did here in Costa Rica is gonna be an amazing job, but they have to keep doing follow-ups, cleanings, and things like that. Okay, it's not that what we're doing right now is forever. Okay, nothing is forever. Okay, so they have to keep doing follow-ups and things like that. Okay.
Well, that's it, doctor. Thank you very much for your time.
It was my pleasure.